Hello, and welcome to the Brave New Weed podcast. And now, here's your host, Joe Dolce.
Welcome to another episode of the Brave New Weed podcast. I'm here with Kyle Moore this week. Kyle's our sound engineer because Matthew's away on vacation. Hi, Kyle.
Hi, Joe. How are you?
I'm very good. How's life in Boulder, Colorado today?
Beautiful, sunny, and full of snowy, wonderful mountains and weed.
Wow, great. Okay. Okay. This is a really interesting episode we have, but before that, I want to talk about the news because a lot's happened this week. We've been calling this podcast the conversation for the post-prohibition era, and it sounds like this week we may actually be entering the post-prohibition era. Have you been reading the news, Kyle?
Well, I've been reading this piece about the States Act, and this could be a game changer because it appears to have the tentative backing of none other than Donald J. Trump.
Well, it's a smart thing to back, I have to say. Maybe the smartest thing he's backed from my point of view ever. What it is a bunch of Republicans and Democrats got together and have crafted some legislation which is called the Strengthening the 10th Amendment Through Entrusting States Act. That's what STATES stands for. And would basically exempt legal cannabis states from all federal pot enforcement, which basically means the war on cannabis has been won, essentially.
Not essentially, in that it only liberates states that are currently have some degree of legalization in progress. Whereas states, let's say red states that do not permit cannabis of any kind would still be under the same restrictive limitations of Schedule 1.
Yeah.
But it is a huge step.
It allows all of the states that want to go legal to do so without any threat of the feds. That means your dispensary can't be raided. It means you're not going to get arrested for a crime for carrying a jar of cannabis. It means that banking can occur within the states that are legal.
It also means that your cannabis business that's in a legal state will no longer have any threat of Jeff Sessions showing up at your door and saying that you cannot operate this business. And by the way, you must close down and lose millions of dollars. This is still currently a problem in Colorado and California. If the Department of Justice sends your business any kind of notice saying you have to shut down, you kind of have to do it. They still have the authority to raid and shut down your businesses, even in legal states.
There's no doubt in my mind that part of Trump's reason for doing this is simply to annoy Jeff Sessions further and maybe force him out of his role.
Poor Mr. Magoo. You picked the wrong job to be in.
He really did. Anyway, this is very interesting. Trump says he's going to back it. It seems to have blue and red support. One of your state senators, actually, was Elizabeth Warren and
Cory Gardner.
Cory Gardner, who is a Republican from Colorado, yeah?
Cory Gardner is a quite staunchly conservative senator from Colorado. He is generally not well liked, at least amongst the Denver, Boulder, Greenbelt crowd. But many Colorado politicians, representatives and senators alike, have really stood up for the cannabis industry because they realize its massive benefits as a tax-generating industry. And I think they're also kind of curious to see what the experiment will turn out to be. And I also don't think that they believe the old guard Republican orthodoxy on pot is the devil's weed. So between standing up for states' rights and standing up for individual liberty and standing up for their constituents, I think that Colorado conservatives has actually done a pretty decent job for the marijuana industry here. So.
It's very interesting also because some this one VC firm called Acreage Holdings has hired John Boehner is now a consultant to them. The former Republican governor of Massachusetts, Bill Weld, is also a consultant to them. So Republicans are not against legalized cannabis as a whole. It's quite interesting, and it makes me think. We interviewed Earl Blumenauer a few weeks ago on this podcast, the Democratic senator, who's also a sponsor of this bill. He's from Oregon. And he said to us, look, no one who's against legal cannabis is going to get elected into federal office anymore. It's over. The prohibition days are really over on that front. And it always makes me think, if Hillary Clinton had a little more guts and was able to take a little stronger stand on cannabis, that those 80,000 votes that she was missing in order to win could have been in her favor.
Alas, that they were not.
Alas, that they were not. So It's very interesting to see that this may be the year that things really change for cannabis, and certainly that will change for federal legislation.
Do you really think that the States Act would kind of take the cuffs off of red states to where traditionally conservative areas of the country would start becoming open to this, especially with the opioid epidemic continuing to destroy a disproportionate number of lives, of Trump voter lives in these parts of the country?
I would think they would be foolish not to, but who can say? I mean, I can't understand why those policies exist, and I can understand why voters continually vote against their own self-interest in those states. That's my particular East Coast liberal point of view here. But it would seem that if it's costing a shitload of money to treat opioid addiction and death, that it's compassionate and it makes great sense. And we are going to have an incredible interview with a doctor in the next few weeks who has done incredible research on the fact that opioids and cannabis work synergistically, and that you can use cannabis to really cut down your opioid use. So there's a lot going on. It's a very good question you ask. It's multi-layered. It's complex, and let's let the information come out. That's one of the reasons we do this podcast, is to help the information get out.
Absolutely. One more thing we didn't talk about in the States Act is that it fully legalizes industrial hemp, which has been federally banned for decades. And legal hemp for fuel, food, fiber, medicine would be a huge boon to red states like Kentucky. Mitch McConnell was actually trying to get some industrial hemp legalized in the recent Farm Bill, I believe, because McConnell recognizes that his own state could really benefit from it. So I think the self-interest portion of these conservative politicians' psyche is starting to kick in, because they want their own states to get a piece of the cannabis pie, or the industrial hemp pie as well.
I think industrial hemp is going to be a huge crop in America. America needs to be doing this. Other countries are doing it. Why we are not at the forefront of it? We have all this land. We have all these other crops that are subsidized. We don't really need more corn. Let's move to something that's beneficial for the soil and maybe creates really great medicine.
You can find Brave New Weed on all the popular social media platforms. You can find us on Facebook, Twitter, and Instagram, all at Brave New Weed.
This week's guest is Dr. Ann Morgan. She is the CMO of MMJ Health Labs in West Palm Beach, Florida. Ann has an amazing story, because a few months ago, she was riding her horse and was thrown, and her brain was severely damaged. The doctors couldn't believe the amount of fluid built up on it. They thought she would never walk, talk, or move again. Well, in fact, she's here with us today to talk to us about her reaction, her recovery, which was really due to the fact that her son, Marshall, owns the medical marijuana health labs in Florida, came to her bedside shortly after she was brought into the ER, determined the amount of CBD oil she should be having, and started dosing her in the hospital without doctors knowing. She is completely convinced, as are her doctors, that the medical cannabis, the CBD oil, helped reduce the inflammation and stop the damage to her brain. And she's here to talk to us about this extraordinary recovery today. And thank you so much for joining me today.
Thank you for inviting me.
My pleasure. You have an amazing story, and I'd like to recount it with you if you don't mind. But before we begin, tell me, you are a practicing physician, correct?
That's correct.
What kind of a doctor are you?
Well, I'm a family doctor. I started out in family medicine by the American Academy of Family Physicians, and then I went on into administrative medicine. I was a medical director for Metropolitan Health and United Health and Humana. And then I went back into private practice.
How many years have you been practicing?
30 years.
Okay. So something rather upsetting happened to you last year, did it not?
Exactly. Yes, it did.
Why don't you tell us a little about your story and your horse, okay?
Okay. Well, I was riding my horse, and she's a lovely Tennessee walking horse. And we were going at a pretty fast clip in a state park. And I didn't realize it, but the the saddle was giving loose, and the cinch, the belt underneath the saddle, gave loose, and there was nothing I could do. I mean, the horse was still, going fast, and I tried to pull back, but that wouldn't have mattered because I was sitting on the saddle. And I saw the grass coming up at my face as I was going down. I did have a helmet on, and as I was going down, I saw the grass coming up at my face, so I quickly threw my forearm in front of my face, which was good because it didn't break my face. It just broke two bones in my arm.
I think it's better to hold your face together. How fast would you say you were going?
Maybe about 8 miles an hour.
Okay, is that fast on a horse? Give me some context.
Not too fast, no. But I was a Tennessee Walker, so it's a smooth ride. I wasn't bouncing.
Okay, very good. So there you are. You're eating the grass. What happens to you?
Well, I actually have amnesia for the full event, other than remembering the grass. I was found, thankfully, by a gentleman that was there in the park doing bird watching, and he and his girlfriend heard me chirping, and he said it was just a weird bird, but she said, no, I think it's a human. And what she told me, I spoke to them afterwards later,
Yes.
and they said that I was saying, help, help. I was crying help, but very, very slightly. So they called for an ambulance and took me to the Jupiter Medical Center, which was the closest hospital. And,
You're in Florida, correct here?
yes. And while I was in the hospital, they told me, and I awakened when I was there, and they told me that I had a bleed in my brain, I had a hemorrhage in my brain, and they were taking me as a trauma case to the trauma hospital in West Palm Beach. So I was transferred there.
What was the thought that went through your mind when you were told you had a bleed in your brain?
Well, I was very frightened because as a doctor, I knew that either I was going to end up into surgery or I might have some brain damage. So it was very frightening. It was very frightening. But then the good news is I don't remember anything after that.
Okay, so that's good. So you had this fear, you were told some bad news, and you stopped remembering things. What happened next?
Well, the next thing I remember was being at the hospital, talking briefly with my surgeon, and then I was gone. I was out in a coma for over a week. My brain, there was too much blood in my brain.
Wow.
The great news is I had a wonderful neurosurgeon who felt that the bleeding had stopped, and therefore he didn't have to operate. So he stayed with me for 4 days and watched me, but I didn't show any signs of changes. I was still, in a coma, but thankfully he didn't operate on my brain.
Were you able to move at this point, or you were just in a coma out flat?
In a coma out flat, and because I had 15 broken bones and a lot of blood in my head, the orders were not to move the patient. So there was no movement of me at all. So, but the good news is, and this is why we're talking, is my son, who is very knowledgeable and he owns a cannabis center, here in Florida, he knew that if he got CBD into my system, it would help my brain, both in recovery and prevention of brain damage. So first they had to get him to the hospital, but once he saw what had happened to me, he went home, and in our kitchen cabinet we had CBD oil, which was from cannabis, not hemp.
Yes.
And we had it for our dog. When our dog had cancer, I had left the bottle in the cabinet. And
wow, okay.
He went and got it, and he put a pretty good amount, because he knew the dosages. He gave me a specific amount underneath my tongue at the hospital twice a day until I came out of the coma, and then he told me about it. So I got it for 7 days, but I got it immediately after the injury, which is so important. And anybody listening to this podcast should know this, that the quicker that you start the CBD, the quicker it helps heal the injury.
So what do we think happened? So wait, you're still in the hospital, you're getting CBD. Let's finish this part of the story. Was there what did you think was going to happen? Did you think you were going to be paralyzed? What are the likely symptoms and likely consequences of having this kind of a brain injury? Please give us a little information.
Well, the good news was I didn't have a cervical spine injury like Christopher Reeves, okay, because it was an injury. I fell in my head like he did, so that didn't happen. But when I saw my CAT scan 6 weeks later, and I saw the areas of bleeding both on the right side and the left side and into different parts of the brain and the ventricles, I actually said to the neurosurgeon, I said, "That's not my CAT scan." He goes, "What?" I said, "Look at it. There's multiple bleeds." I said, "This is a stroke victim." And he said, "No, Ann." He said, "That's your CAT scan." So I thought if I had been a clinician and seeing that CAT scan and you asked me, "What do you think is going on with this patient?" I'd say, "Well, this is a patient with a, multi-level stroke."
Something much more serious?
Yeah, and paralyzed on one side. Totally. I could not believe it when he told me that was my CAT scan. And he said to me, "Why do you think it's not your CAT scan?" Because I didn't remember him from when he was taking care of me. It was 6 weeks later. I came in my wheelchair to see him at the hospital. And he kissed me on the forehead and said, "Thank God you're alive." But I said to him, "But that's not my CAT scan." And he said, "Why do you believe that?" And I said, "Because I was told I just had one bleed." He said, No, that's not the truth." So it was a horrendous CAT scan.
Tell me, what were you able to walk after you had? Obviously, you're in a wheelchair. Tell me the story of your recovery, please, and how you think. Well, let's talk about your recovery first.
Okay, so when I woke up, of course, I had a headache the size of Delaware, but I had told them I don't want narcotics, and I started taking the CBD myself twice a day because now I was awake and alert, but I couldn't walk, I couldn't get out of the bed, and but I was alert, which was a great sign. My speech was really garbled. I could not remember sequences. I couldn't do simple addition. Things that they were asking me for cognitive, evaluation was not great. Okay. However, it was improving every day. Now, part of it would have been, just the blood clearing. If a doctor's listening to this, the doctor would say, "Well, how do you know that it wasn't just the blood being cleared and everything like that?" But the answer to that is there was too much blood in there. There was too much going on in the brain that it could not have cleared on its own without the CBD. And so ultimately, they put me in a wheelchair, and then I started with physical therapy. Oh, I had broken bones in my pelvis and broken bones in my ribs and broken bones in my arm, and it hurt, but I was able to do my therapy because my head was clear and I could follow directions. So after a month in the hospital, then I was transferred to an ortho rehab center for a month. And then I went from the wheelchair to the walker. And I went home with a walker, but I was able to walk again. I think also, to be honest, that the fact that I was a week being immobilized because I was in the coma, that actually allowed several of the fractures in the pelvis to heal.
Yes.
You can't do much for pelvis,
Yes. Yeah. And that hurts a lot, I know. How do you think CBD affected your healing? What do you think the relationship was? Because we don't really know the mechanisms by which this works. What do you think happened, and what did your doctors say when you told them about this?
Well, the doctor was just amazed. He couldn't believe it. He says, "If that's what's working for you, that's great." So I asked him, "Have you heard about this before, seen this before?" And he said, "Yes." He says, "This is not the first time, although, he's a neurosurgeon, so he doesn't have time to learn about the endocannabinoid system. In fact, he's just recently retired, sadly, but I believe that because it gives neuroprotection and allows for new pathways, what we call neuroplasticity, to occur. Okay, it has healing powers to the nerve pathways. So the nerve pathways were regenerated, I believe, or new ones were produced. I don't know which. My son took a video of me saying she sells seashells by the seashore, and there's no way I could do that. But that had to have come from the CBD, because that does not come that quickly in a stroke victim.
Did you happen to know at the time that the U.S. government owns a patent with a very long number, I can't remember the number, that patents the cannabinoids for neuroprotection? Did you have any idea of that?
Oh, sure. I learned that about 6 years ago when I couldn't sleep, and I found it at 4:00 in the morning, and I was like jumping up and down. I said, "Are you kidding me?" It says cannabis is neuroprotective against Alzheimer's, Parkinson's disease, ischemic cardiac damage, which means lack of blood supply, and ischemic brain damage, which is lack of blood supply to parts of the brain. But they still say it has no medicinal value.
So can you explain that to the listeners? I've explained it, but I'd love your take on it, please.
Well, the government owns a patent, and the patent is not like owning a pill or a compound. It's the idea based upon research that the government deemed to be very important, that they immediately, the minute the research came out, they immediately filed for the patent and got it approved for the fact, just the fact that, and that's odd, but that's unusual, the fact or yeah, I guess it's a fact. So it's the fact that cannabis is neuroprotective and protective against Alzheimer's, or helps prevent against Alzheimer's, Parkinson's disease, ischemic cardiac disease, and ischemic cerebral disease. And I find that to be so offensive as a citizen, because we lose thousands of people to Alzheimer's and Parkinson's. And, we're expecting out of the baby boomers, like 1 out of 6 to 1 out of 8 will come down with Alzheimer's. And as a clinician, I'm thinking, who's going to take care of all these people? What's going to happen to them?
Did you know that Julius Axelrod, the man who uncovered the dopamine pathways, was a signatory on that patent?
No, I didn't know that. That's interesting to know.
That's really interesting. Yeah, it's a really interesting fact. So they've held the patent, but no one's in the United States has been able to do any research on it, correct?
That's correct, because they haven't. They wouldn't let it. They have not allowed any of it to go out, to be sectioned off. I suspect, though, as it gets closer to its time where it runs out, that they will probably sell off parts of it. Like, oh, gee, let's sell off the part for Alzheimer's to a pharmaceutical company, or let's sell it off to a part where it helps against, cardiac ischemia. That'll be sold. And once it's sold, then I, as a clinician, will I be able to recommend it to my patient without them having to buy a pharmaceutical product? When I also say, well, I also know that if I recommend it as a cannabis product, a cannabis-made product, not a pharmaceutical, that it also helps against Alzheimer's. Because I see a lot of patients here, and they're just like me, that have had what we call traumatic brain injury. And anybody that's had a traumatic brain injury has a much higher risk for developing Alzheimer's. So I'm still taking it. I'm not even 6 months out from my head injury, so I have to still take it. But I'm going to take it the rest of my life so I don't develop Alzheimer's.
I don't blame you. I mean, let's talk about how this could possibly impact, say, football players or boxers. These people are receiving hundreds, if not thousands, of injuries to the brain every year. And as we know, it doesn't have to be a dreadful impact. Even a small impact causes some injury to the brain. Am I correct?
That's correct. And I have done a lot of research and work about the football players, and I, along with a few other people, are in the process of creating or writing up protocols, but it's going to be hard to get the NFL to follow it. But since they've already admitted that, head injuries does cause, issues, encephalopathy, then maybe they might listen. But if you ask me my thoughts, we should have helmets that indicate how much pressure the head has sustained. When it has sustained X amount of, what do you call it, pounds per pressure or whatever it is. I'm not technical. But once that's happened, then the signal should go to the doctor in the what do you call that, the practice room, and then take the player off the scene, start an IV, and give them an infusion of CBD immediately. And then after that, then they'll continue it for X amount of days. And there's some other things we also would like to add, but CBD is the most important thing for them to get. And it should be with high school players too. My son played high school football, and I saw kids get concussed. So this is a lifelong thing of multiple injuries on these football players. Like Junior Seau was one of my heroes, and he took a lot of hits. So if you could imagine that if you just bring him into the it's called the locker room. Sorry, into the locker room.
A real sports fan you are.
Yeah, you're right. I didn't play any team sports, but if we gave them an infusion of our protocol, and by the way, before the beginning of the game, they take a cognitive test, on a laptop, and then afterward, they take a cognitive test. If they show improvement enough that they could go back into the game, that's fine. If they don't show improvement, they don't go back. But that's a way to follow it.
You're a physician, and many of your colleagues don't know very much about cannabis. What do you think you or anybody can be doing about this? I'm talking about cannabis as medicine or cannabinoid therapies.
Interestingly enough, since I've been practicing cannabis medicine, there are quite a few doctors that recommend their patients to me. However, I'm a member of the Palm Beach County Medical Society, and I was on their medical marijuana task force writing, the guidelines that we sent to the state of Florida. Some of them they paid attention, some of them they didn't. But I wrote in the weekly newsletter that goes online an advertisement to all the doctors saying, I'm board certified by the American Academy of Cannabinoid Medicine, a member of the Society of Cannabis Clinicians, the International Cannabis Research Society. So I've got the credentials that my fellow colleagues would understand. And I offered to come to their office, at no charge, for half an hour, lunchtime, whenever, to tell them about the endocannabinoid system and their staff, so they would have at least some understanding of how I could help their patients, rather than writing for, so many pain medicines or anxiety medicines or antidepressants, any of those meds. And not one doctor called me from that ad.
Okay. All right. What do you say to your colleagues when they say, "Oh, there's no proof about this. There's no research. This is a plant medicine. Plants aren't reliable." What's your response?
The first response is I tell them, "Listen, are you still writing? Are you writing a lot of prescriptions every day?" And they say, "Of course I am." And I tell them, "Well, I got one word for you. That's Vioxx. Vioxx was a drug that killed several thousand people. It was approved by the FDA. Thank God I never wrote for it, but it was an anti-inflammatory. So I tell them the word Vioxx. They know how scary that is. So, but then I tell them, listen, this is a plant that has never killed or hurt anybody. Why wouldn't you want to learn about this? And they say, well, we don't have time. We've got this or that. And I think it's their ignorance comes from their lack of time, not because of their lack of interest, to be honest. I don't think it's that.
Interesting. How do you think we can help educate your colleagues?
Okay. Well, then, you know what? The only way that they are getting educated right now, because I'm not doing speaking appearances as much as I used to, is that the patients go back to them and tell them, and it's funny because I tell my patients the same thing. I tell them, listen, I'm not taking you off any of the medicines you're on, but you're on a antidepressant. But when you're not depressed anymore, go back to the doctor that wrote the prescription and ask the doctor how to wean yourself off the medicine. And you know what? When that happens more and more to these doctors, when their patients go back, that will teach them.
That's a slow process, huh? One by one, patient by patient.
It is, exactly. But it's interesting. The ones that have seen my patients, guess who they send me first and foremost? They send me their family members.
Got it. What does that say to you?
Well, it means that we've got an open dialogue because I can talk to them about their family members. And then once they see that their family members are getting some relief or improvement, and I can't say that that's not happening. I've not had any treatment failures, to be honest, that, the referrals will come. But it's sad here in Florida with all the tough rules they made. The easiest thing they made was for a doctor to recommend cannabis. Here in Florida, all they have to do is take a 2-hour online course. So all those patients that go to those other doctors that don't know about the endocannabinoid system, they go to a dispensary and they get sold whatever. Those folks, they're not getting the therapeutics, and that's sad. That's very sad.
Yeah, very much so. So how is your condition today? You're ambulatory. Obviously, your brain is working. Are you back?
I'm back. I've been back to work. Let's see, the injury happened December 3rd. And I came out of the rehab the end of January and got back to work in February. And I've been working full time now. And as far as movement, I'm moving fine. I have a little trouble when I get out of a chair the first couple steps because of the broken pelvis. My brain is fine. I have no deficits neurologically. And the only thing is I'm not allowed to ride horses anymore. So I've had to sell my horses.
Oh, I'm sorry.
Yeah. And they also told me I can't ride a bicycle, which I asked them why, what's the big deal on a bicycle? And they said if you had a head injury, that would be terrible.
But you feel well.
I feel great. You know what? I honestly, you would not know that I had 15 broken bones several months ago. In fact, you wouldn't have known it at month 2. I was fine. In fact, when I was at the ortho rehab, they could not believe how much I was moving around. And without pain medicine. I didn't take pain medicine. I took a few times.
Were you using cannabis for pain relief?
A little bit, but not much, no. Really, I honestly didn't have pain.
You're sort of a miracle. You're like a poster child for recovery, aren't you?
I am, but I have to tell you, I did take high doses of CBD.
Oh, yes. I wanted to ask you, how high were your doses?
In the hospital, I was at 75 milligrams twice a day. But when I was in charge and I was doing my rehab and the joints and the bones and all that stiffness and, after working out with rehab, and I did it 3 times a day. I had physical therapy, speech therapy, cognitive therapy. They were great. The folks at La Posada were great. But I upped it to, I think it was at between 100 and 125 milligrams twice a day.
Well, that's not excessive, but good for you. Did you have any side effects from it at all?
No.
Yeah, it's really imperceptible. Isn't it a strange thing, huh?
Well, they say it has a calming, relaxing effect.
At a low dose, but I've also heard that at a high dose like yours, it induces a state of wakefulness.
Not for me, but I will tell you, when I went for my last MRI, and I don't have anxiety, so that wasn't an issue, but when I went for my last MRI, normally, my MRIs, I sit there and it's a noise and I'm saying to myself, oh, gee whiz, when is this going to be over? I get a little, antsy. When I went in for my last MRI, I had the CBD on board, of course, the first time I didn't, but I did, and I didn't get antsy. So that little 2% of lowering, anxiety or agitation or whatever we say that CBD does, I felt it because I wasn't, bitching in my brain saying, oh, gee, when is this going to be over,
And I'm so happy we had this conversation. I can't thank you enough for your time and your thoughts and for sharing your experience with us. I really appreciate it.
Thank you. And may I just say one thing, how it affected my life?
Yes, please. I would love to know. Yeah.
First of all, it's made me grateful to be alive. It's made me much more sensitive and aware to people and their problems. And also the fact as a clinician that people are on so many medications they don't need to be on that can be helped and managed with cannabis. And that's the awareness that I need to speak out. And thank you for asking me to be in the podcast where somebody might hear this.
That's what I'm hoping. And keep speaking out. That's the only way it can change things, right?
That's true. Thank you.
We're growing and we're growing quickly. And one of the ways we're growing is when people share our podcast with people they think might be interested in it. So we want to encourage you to hit that share button and send an episode to somebody you think will find it of interest.
Joe, that was such an inspiring story, and I think this has a great potential to illustrate the incredible medical benefits of medical cannabis, especially in regards to people who have suffered traumatic brain injury, whether it be from serving overseas in the military or being an athlete in this country. We see all these stories about athletes in their mid-30s to 40s, especially NFL players who are committing suicide, who are doing all kinds of very acharacteristic things, or who are just becoming suffering from dementia at age 40. And maybe cannabis could be the thing that saves them.
Well, there's a football player called Mike James. I think he's from, I can't remember where he's from. He is trying to bring suit against one of the leagues because he uses medical cannabis currently, and he wants to be allowed to use it. There's a lot of small activity going on, but the fact that this is a potentially medical game changer blows my mind. And the first research about this happened in Israel with people who were wounded in war. They were given medical cannabis within, I think, 4 hours after the injury, and the amount of the toxins that were released, it's called a glutamate response, was severely reduced. So there's always been an indication that this works, but there's never been full-on research studies into doing it. And when you hear a story like Anne's, all you can say is why and why not.
Well, we now live in this era where a lot of our military veterans are coming home with traumatic brain injury as a result of concussive exposure to explosions from all these things overseas. And because of body armor, their bodies are often saved, but their brains still suffer from all of this trauma. And boy, oh boy, if Donald Trump and Jeff Sessions really care about their military contingent, they would be really well advised to look into medical research of CBD in regards to traumatic brain injury, because that would do miracles for many, many of their constituents.
Well, maybe one of our listeners will take it upon themselves to send this podcast to DJT and Mr. Sessions, and let's let them make the decision from that.
That would be a true wonder.
Kyle, great to have you with me this week. I hope to hear from you again. I want to do this with you more.
It's great to It's great to be a correspondent from the magical state of Colorado, where all things are legal and wonderful.
Good. I look forward to talking to you again, and I look forward to doing our next podcast and inviting all the listeners to join us and keep sending it out to their friends and their favorite people.
Absolutely. We'll see everyone in 2 weeks.
Thanks for listening to the Brave New Weed podcast. This episode and all future episodes are made possible by amazing listeners like yourself. If you like what you've heard, we encourage you to show your support by giving $1 a month for special access and rewards on patreon.com/bravenewweed. You can also follow us on Twitter and Instagram via @bravenewweed. Find us on Facebook at facebook.com/bravenewweed. And remember, you can always find more information about us or information discussed in each episode by pointing your favorite browser to bravenewweed.com.